New at 6 and first on 2, a medical breakthrough that could save the lives of hundreds of people living right here in Dayton.
Tonight, a team of doctors is preparing Miami Valley Hospital to become a world-class center for transplants. As Marsha Bonhart discovered, patients will no longer have to travel to 3 of Ohio's biggest cities for groundbreaking surgery.
So what's your answer?
99.
Very good.
For Bobby Hagens, an evening with family means even more lately. The Jefferson Township man, now 42 years old, has struggled with type 1 diabetes since he was 17.
When they first diagnosed me, no, I didn't take care of it the way I should have. Because when you're young, you think, oh, it's not going to be nothing, you know, and you don't really take care of everything you should, like you're changing your eating habits and stuff.
But like thousands of other Americans, Hagens ignored the advice to take better care of himself. Because his pancreas did not make insulin to convert food into cellular energy, uncontrolled blood sugar took a terrible toll on Hagens' vital organs. One of the first signs of trouble, nerve damage in his feet. And 25 years of damage didn't stop there.
Lost vision from the diabetes, so this is a prosthetic eye. So just an accumulation of everything from basically the diabetes is what starts the whole kidney problem.
Diabetes also made one of Hagens' kidneys fail. So on March 18th, doctors at the University of Cincinnati gave Hagens a new kidney and pancreas. The simultaneous transplant saved his life.
It's just a bigger operation for patients when you transplant both a pancreas and a kidney at the same time.
Dr. E. Steve Woodall is chief of transplant surgery at the UC hospitals, a leader in pancreas transplants. For weeks now, he's been helping Hagens recover. It's an hour drive from Jefferson Township and a 4 to 5 hour visit each time, which means Hagens and his wife Sherlyn are racking up the miles on the highway.
It's been 25 years in the making, which is more than half of my life. So, yeah, if I had to go to Timbuktu, I probably would have to get it done.
That would be a whole new... Does she have a living daughter?
Enter this husband and wife team. Dr. Brian Stevens and Dr. Lucille Renshaw joined Miami Valley Hospital's Transplant Center last January. They plan to create world-class care that includes pancreas transplants. This will be a first in the Dayton region and will put our city in the same league with Cincinnati, Columbus, and Cleveland.
These patients already are here in this city, and as good as OSU is and as good as University of Cincinnati is, and they are very good, patients don't want to go. They don't want to go somewhere else.
Pancreas-only transplants are tricky procedures. The American Diabetes Association says half of patients reject them, so hometown care is just another way to ensure patients survive and thrive.
If they only have to drive 10 or 15 minutes instead of driving an hour, they're much less likely to miss appointments. They're, more likely to stay in touch. It was easier for us to get in touch, bring them in quickly if we need to. I think that the patients themselves do better when you've got that service in their hometown.
How crucial is quality transplant care? The National Kidney Foundation says 90% of patients like Hagens who get a simultaneous kidney-pancreas transplant survive 2 years. Since the transplant and associated care costs about $141,000 and organs are scarce, Drs. Stevens and Renshaw say they will do everything in their power to build a premier transplant center in Dayton.
The physicians here that are taking care of these patients want to continue taking care of these patients, the nephrologists in particular, the endocrinologists as well. And, they want to be able to partner with a group that's in their community. It's just very simple. So the city is large enough, the population is large enough, the surrounding area is certainly large enough. This part of the country is large enough to support multiple centers of excellence in pancreas and kidney transplantation.
The transplant took Bobby Hagens off kidney dialysis, and he is no longer diabetic. Today he counts his blessings, knowing full well he has a new lease on life.
It has been an experience, but it's all worth it, In the long run, it was all worth it. I can't say that it was easy.
I feel real blessed. It's like they you asked the question, do you believe in miracles? I'm a firm believer in miracles.
Dr. Stevens and Renshaw at Miami Valley Hospital hope to do their first pancreas transplants next year. They will also teach at Wright State University, researching ways to prevent organ rejection, because that is probably one of the biggest obstacles to the transplant being successful.
Right.
Absolutely amazing. So obviously some big news, great for our city, and for these very sick people, a wonderful opportunity.
Yeah, there's opportunity there, but we have to remember and keep in mind always that getting that donor is rare. And, you know, there are 20 people die across the country every day waiting on some kind of organ. Right now we're speaking specifically about pancreas, but we need help, so contact Life Connection of Ohio. There's a link posted at WDTN.com. And if you want to remember, one donor can save the lives of 8 people.
The gift of life, extremely important. Marcia, thank you very much.